Dr. Christy Edis. You know, if you've ever had back pain, how blech and miserable it can make you, and not just you, but your family, your friends, your partner. So thank you guys for putting up with us, certainly. And you don't want to do anything that's going to cause that to get worse or come back, and that includes exercise. So today we're going to go over 3 exercises that are probably doing that back more harm than good, and some alternatives to try so that you can keep feeling better. So the very first exercise, numero uno, is the dumbbell side bend. And I'll just say right now, I did so many takes of this exercise that it actually caused me to have back pain. So I'm using a very light weight to demonstrate. I need a friend to help me out with this part of it, I think. All right, so that exercise, right, is just holding a dumbbell in the side and doing this. We've all seen this one. Sometimes you do it with 1 dumbbell, sometimes 2, sometimes 1 in the opposite hand. Let me tell you though, it doesn't matter. No matter where you put the dumbbell, it's still not going to be awesome for this back. The first reason is because it does put a bit of a shear force in the spine, and that's not the worst of it there. That's just a little part of it. The worst is that it actually tightens up this muscle here called your quadratus lumborum. Big fancy word for the day, but that muscle attaches to the rib cage, to the spine, and to the hip. So if you have anything going on in the hip, in the muscles, in the spine, in the joint, in the ligaments, this muscle tends to get really pretty cranky, and you don't want a cranky muscle. So this tends to make it even crankier. So that's really the number 1 reason you want to not do this one. Now, you may even want to avoid oblique exercise in general because to really get the obliques, here's the other issue with this one, it's not just a side bend, it's really a rotational component. So if this does bother your back to rotate, obviously hold off on this one, right? But I'm going to get down on the ground, hopefully. And to get those obliques, I'm going to put my hands behind my head. You're going to think about pulling that belly button in, and it's a very gentle lift. Notice I'm not lifting high, I'm not pulling my head. And then I'm going to use the side, those obliques, to actually rotate me towards that opposite leg. I'm not pulling with my elbow, which is a great, arm shoulder workout, but it doesn't necessarily use those obliques as well. So it's a small motion, right, guiding with those muscles. That's kind of the beginning. If you want to be a little bit more advanced, you can go into a side plank with a rotation. Like this one is definitely tougher, and it's always good to start out with those knees bent. So pushing up into that side plank, hand behind the head, and you're going to rotate as kind of one unit. It's like a barbecue spit, right? Again, this is a little more advanced, and clearly make sure it doesn't hurt because that's not a good thing either. All right, there's your alternatives. Number 2 is the scorpion. In the scorpion exercise, you're lying on your stomach, and the goal is to bring that leg up, over, and across. And the goal here is trying to get mobility in through that lumbar spine, which actually doesn't move that much. It does move a little, but we don't want to force that lumbar spine into movement. We really want to get movement up above in the thoracic spine. To get some motion into the thoracic, or that middle part of the spine, a nice way to kind of ease into that is a hands and knees position. You can certainly put a pillow or a blanket underneath if you need a little protection on those knees, even the bed. But you're going to come up, and as long as it feels okay on the shoulder, hand's going to go behind the head. I'm going to concentrate on dipping towards that opposite hand, and then I'm going to rotate, really kind of pulling, making sure I'm pulling from that rib cage area open. So it's down and open. And of course, make sure you get both sides as long as it's comfortable, right? Remember, if it's painful, please don't do it. If you do need a little bit of motion in that lumbar spine, a bit of a gentler way to do that is, and again, another awesome one you can just do in bed, is just lying down and just a little gentle rock of those knees side to side. I'm obviously getting hip motion in here, right? But it does get a little bit into that lumbar spine. But again, just a little bit, which is all we want, and in a pain-free motion. So if it feels good to go lower, you can go a little bit lower, but you don't have to make it effective. All right, I'm going to stay right here for our 3rd and final exercise, which is the full sit-up. Now, the sit-up is one of those exercises that, yes, I know some people absolutely have to do, and if you have to do it, you have to do it, but it does put a lot of stress on the spine. Now, you are trying to use those abdominal muscles when you're doing that full sit-up. But in order to prevent some of that kind of shearing, yucky force in the spine, you need to be able to tilt your pelvis into that posterior pelvic tilt and actually hold that. I'm like a struggling something. I don't know. Hold that the whole time without lifting your legs up. I am terrible at this one. You can see why I don't do this. I got back stuff. But when you do have back pain, or you've experienced back pain for 30 days or more, even if it's in the past, those deep abdominal muscles actually shut down. So getting yourself to hold that pelvic tilt and come up is really, really hard to do. Right? So a lot of times what happens is you maybe start in that tilt and then you kind of shift into that anterior tilt and use those hip flexors. I'm going to grab Bert real quick here. Mr. Bert Ebrey. Poor guy needs to eat a little bit. Give him some peanut butter cups. But the hip flexor muscles, yes, they're in the front of the hip, but they actually end up attaching into the spine, right? Right down here in that lumbar spine, which is what we're talking about. And so if you're tightening those up, which tend to already be tight, you're just going to pull right on that spine. So both of those things are not good. And the other thing in the sit-up, a lot of times people will put their feet, right, hook it under something. You're actually using your hip flexors even more when you do that, which is obviously not going to be helpful and tightens them up even more. So really and truly, I love people to work on those deep abdominal muscles to help with that stabilization part first. So think about gently pulling the belly button in, getting your comfortable spine position. You can put your hands right on your hips so that you know where things are, right? That you're not tilting and twisting or rocking back and forth. And then even just starting with a mental, starting with a simple little march sounds so easy, but if those muscles aren't working, believe it or not, this can be really challenging, okay? Once those start to activate, then you can add a little bit more fancy schmancy moves in there. Even a partial crunch. So I'm going to dig my heels in so that I'm actually activating the hamstrings, which helps take out the hip flexors a little. I'm going to put my hands above my head or behind. You can cross them, whichever is more comfortable. And then it's just that little lift, really focusing on lifting from here, right? Lifting from that lower abdominal area. And don't bloop the belly out, right? Keep things pulled in nice and tight while breathing. So there's a couple options for you instead of that sit-up. So thanks so much for tuning in today, and stay tuned for more. Thank you so much for watching today. If you would like to support me as well as reduce some pain and get rid of the appearance of that cellulite, click the link below to order your own Derma Edge, a device that I created and patented when I was going through the middle of Lyme disease in a lot of pain and needed a way to work on my own body. So the shape of the Derma Edge allows you to get all body parts in a gentle way. We're getting that fluid moving in between the layers, which helps you move better, helps get rid of that pain, and decreases that bumpiness of the cellulite. So make sure to click the link below to order your own.